All right, good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton Montgomery County. Thank you for being here today. I'd like to report out to our community with some more information regarding our response as a community to this COVID-19 pandemic. We have several speakers here today as well. We have Mayor Nan Whaley from the City of Dayton. We have Vince Parisi, President and CEO of DP&L. We have Sarah Hackenbrack, President and CEO of the Greater Dayton Area Hospital Association, and then Michael Doan, Public Health Medical Director. So we all understand the numbers. They continue to increase across the globe, in this country, and across Ohio. Nationally, over 55,000 cases of COVID-19 have been confirmed, 801 deaths across this country. For Ohio, yesterday we were at 542 cases. We are now at 704 confirmed cases in our state. 55 of our 88 counties have a confirmed case. And unfortunately, the number of individuals who have died as a result of infection is now at 10 in this state. In a very disturbing trend, in a sense, 116 of those confirmed cases are healthcare workers. So it's vital that everything that we do moving forward, we have to protect our healthcare workers. 182 of those individuals are also hospitalized. 75 of those individuals are in intensive care. So the age range across Ohio is again 1 to age 94, so affecting all age ranges. And to date, 14,764 tests have been completed in the state of Ohio. And so if you look at the percent of positive based on that number, it's roughly about 5% of those test results are turning out positive right now in terms of COVID-19 infection. In Montgomery County, we are at 14 confirmed cases. We have 7 males and 7 females. 2 of those individuals are hospitalized. It's pretty clear to all of us, though, that we will never know the actual number of total cases. Remember, we estimate 40 to 70% of the population will be infected by this virus. Not everyone will show symptoms, and many people who have symptoms will not be tested. So we've talked extensively, and you've heard it from the very beginning of these news conferences. You hear it from our governor and Ohio Department of Health Director Amy Acton. You hear it nationally. We've talked extensively about flattening the epidemic curve. And our desire is for a more gradual rate of infection over a longer period of time, as opposed to a sudden onset and incredible rise initially and peak of cases. We want to slow that epi curve over time. And the reason we want to do that is because we do not want our healthcare system and our hospitals overwhelmed with patients. So to flatten that curve, we've talked at every news conference that we have to apply these social distancing measures. We all need to adhere to the stay-at-home order issued by the governor and signed by the Ohio Department of Health Director Amy Acton. We need to add capacity for testing, as we've talked about. We need to ensure that we continue to expand and extend the use of personal protective equipment for those that need it. And we need to continue our planning for surge capacity for our hospital systems. So yes, the question continues to surface regarding the stay-at-home order in terms of what is an essential business and operation. Those criteria are listed in that order. However, the public health information line that's been set up continues to receive a lot of calls. We're getting about 200 calls a day requesting information and clarification regarding that order. So a lot of those calls are from employees that work at a business. One of the challenges right now is that a lot of those calls, most, quite frankly, are anonymous. They'll indicate the business, and they'll feel that it's a non-essential business, but it's continuing to operate. Or that it's an essential business, they understand that, but that business is not complying with the social distancing requirements in the order. So public health is in the process of compiling all of that information, and then we are going to be contacting all of those businesses, number one, to determine the validity of the complaint. We cannot automatically rush to judgment that a business is not complying. So we need to determine validity. Please keep in mind that this emergency stay-at-home order covers many businesses and sectors that public health does not normally regulate. So we have no contact information and no established relationship with these entities. So we have to have time to go through that process to get in touch with them. And clearly our goal is regional consistency in terms of how we enforce this order. I believe the public would much prefer getting the same message, and businesses getting the same message in Montgomery County that they get in Clark County and Greene and Miami and Butler and Warren and Hamilton and so forth. So we're working with the health departments in the west central region of Ohio and the southwest region of this state to make sure that we're all in agreement in terms of what is essential and what is non-essential. Keep in mind, this is only the second day of this stay-at-home order. It may take us a little bit longer, but ultimately we'll have consensus and we'll be giving consistent advice to all businesses. And we'll get that information on our website as soon as possible. We want to do this right because it's very likely, I think we all understand, if we're not able to flatten the curve, this stay-at-home order may be extended beyond April 6th. So we want to make sure that we do this right from the start. And with that, I would like to introduce Mayor Whaley, who has some comments from the City of Dayton.
Thank you, Commissioner. Good afternoon. Again, I just want to commend Commissioner Cooper and his team on this really great work that public health is doing and undertaking. In addition to, enforcing the order, which again are new relationships, new people, they're also the front lines of what we're starting to see in our community when it comes to our health situation. And they've just done a tremendous job. I talked to other mayors and communities across the state, and I just feel so lucky that we're in this region that works so well together, both from our hospitals, from public health. I can say that's not the case in other parts of our state, and it takes great leadership to do that, Commissioner Cooper, so thank you so much. And I also just want to say, too, had lots of conversations today in federal legislation that's underway, as well as with some leaders across the community. And the work that our healthcare workers are doing is truly heroic as they're putting themselves in harm's way, particularly those that are working in nursing homes and working in multiple nursing homes at low wage. It is amazing the compassion that people have for people that they're not related to, and are working to keep people alive every day and putting themselves at risk. And so I want to say just how grateful I am for particularly people working in nursing homes, especially right now. So we've had a lot of conversations today, this past month, about evictions, and there's been some confusions because of the multiple jurisdictions across the county and the region about evictions and rent. And so let me just make a couple of points again. First, if you can pay your rent, please pay your rent. With this third round stimulus package being debated and moving forward in the federal government, it looks like there will be some funding that comes forward. I encourage people to pay their rent first, so that way they don't get to a situation after this crisis where they have to move. The evictions are not allowed in the city of Dayton until April 30th. That means the courts will not move on them until April 30th. They put an order to stop. That does not mean that landlords will not put forward eviction notices, but like we said yesterday, we ask people not to move out unless law enforcement is present on an eviction. We know that not everybody watching this and listening to this lives in the city of Dayton, and each community's municipal court has handled this a little bit differently. So with the help of Miami Valley Fair Housing Center, ABLE, which is legal aid, the Human Relations Council, and CAP, they've come together to put forward a website. So there's all the details about each jurisdiction, where you can go for help on rental assistance and issues around eviction. And it is MVCOVID19eviction.com. So MVCOVID19eviction.com. There's numbers and places for you to get help and also to understand exactly what's going on regarding housing in the region of the Dayton area. But please, the reason why we're putting this eviction order in place in Dayton is not about the economy necessarily, but it's about safety. It is so important that everyone stays home, that the courts made an order that they're not even going to move on important court matters. That's how important it is that people don't go around unnecessarily. We really are trying to get people to save lives. I'm so proud of Dayton to continue to do that. I see the roads get less and less busy every day. We're encouraging people to stay home, but take a walk today. It's very sunny out and a nice day. We encourage you to get that kind of exercise. Just keep your distance from other folks. But please, that's what this eviction order is about. It's about safety and public health. We encourage everyone to do their best for Daytonians and our community by staying home. Thanks, Commissioner.
I'd like to introduce Vince Parisi, President and CEO of Dayton Power and Light.
Thank you, Commissioner Cooper, and thank you, Mayor Whaley, for your leadership in this and all the work that you're doing, Commissioner, with the community. Hi, I'm Vince Parisi. I'm President and CEO of Dayton Power and Light. Primarily for us, safety of our customers and safety of our employees is really at the top of everything that we do. One of the great things about being part of Dayton Power and Light is we are part of a broader global company, AES, that really enabled us to start to take steps early on, early in February, to start to look at this and understand what we need to do ultimately to make sure that we continue to provide the essential service that is electricity. So we really started our planning and working on our continuity plan with respect to how we would be able to continue to provide that service early on in February, with a primary goal of really trying to move as many of our people out of the offices as possible. All of our employees, all of our team are critical and essential to what we do. But we have a few of our centers that we have people that ultimately need to be in place. And so what we wanted to do was make sure that we could move as many people out of those centers as quickly as possible to ensure that we would be able to continue the continuity of service that you're all have grown accustomed to. So beginning the 13th of this month, we're really able to move most of our folks out of our various centers, including our customer call center. Great thank you to our team, to our IT team, to our customer contact team for all the work they did to really enable all of our people to get out of the offices and work from home so we could be sure that we'd be able to continue to provide that service. We've also taken a bunch of additional steps to try to protect the people that need to be in place to ensure service. So we're practicing social distancing within our centers. We've asked any contractors or third parties not to come to our centers so that ultimately the people that need to be there are protected. We've asked our employees that do have to come into centers to be sure to take their temperature the evening before they come in the morning, that they do, with that guidance of 100.4 being, kind of a critical place. So we're taking every step that we can to ensure that the people that need to be in place are there to ensure the service continues. We're also working with our teams on a daily basis to make sure that their health and their safety is good. Working remotely is different. Our teams have really embraced it, and a huge thank you to all of them for really taking it on. So our call center continues to be available. Our folks are working from home, but if you need to get a hold of our call centers, our residential customer call number is 800-433-8500. Our business customer call center is 800-253-5801. But you can get a hold of us and really do virtually everything, either through our website at mydpnl.com or through our IVR system. A couple of steps that we've taken, because we understand during this time for our customers, it's a challenge. A lot of folks are out of work. A lot of folks are struggling to understand what to do and ultimately to pay those bills. So we did suspend any kind of disconnections for non-payment back on the 13th of this month of March, just to ensure that our customers continue to have service. Unfortunately, we have been hearing some scammers out there making calls to folks and demanding payment within 30 minutes. This is not us. We are not doing that. We are not asking anyone to make payments within 30 minutes. We do encourage people to continue to pay their bill if they can, as much of it as they can, because we are worried and concerned about those balances that could add up. But we're not making that call. We do have a website set up, dpandl.com/scam, if you'd like to hear more information on that. We are continuing any emergency service that needs to be done, so if there's any issue with respect to an emergency service that you need, we are remaining available for that. We are keeping our crews in place. We're not mustering together. We're sending them right out to the field so that ultimately they're available. What we'd like you to understand is we've asked them to ultimately practice social distancing with respect to even our customers, just so that we're being safe and that we're protecting our employees as well as our customers. But if you do have a critical issue, if you do have a need for us, call us, let us know. We can come out. We will obviously follow all the appropriate procedures to make sure that we're keeping each other safe. And I believe that is it. Thank you.
Thanks, Dan.
Now we'd like to introduce Sarah Hackenbrack, President and CEO of the Greater Dayton Area Hospital Association.
Thank you, sir. Good afternoon, everyone. The Greater Dayton Area Hospital Association represents 29 hospitals and health systems in the Greater Dayton area. And for our members and for hospitals across the country, planning and preparedness is a way of life for our hospitals and our healthcare workers. We are entering a new phase of that activity, and we are activating our plans, and we are continuously looking at our evaluation options for space and capacity to ensure that we have the internal capacity needed to prepare for the surge that we anticipate that is coming with COVID-19. For our member hospitals, that means converting individual patient rooms potentially into double rooms. That means converting units so that they can serve as intensive care units, and looking at other campus facilities where patient care may not normally be provided, but patient care could be provided under these circumstances. We're also strengthening our external partnerships with healthcare providers, those who are non-hospital entities, but may be able to assist us during the surge capacity with patients who need some type of health care. And we are building our regional plans, strengthening the plans that exist for our surge capacity and our alternate care facilities, and making sure that we are preparing the region's medical shelter options should those facilities need to be called into action. Those facilities are regional medical shelters, or the federal medical shelters, if they are stood up, would be geared to caring for low acuity patients who do not need care inside of our hospitals, but need to be cared for or medically managed by someone who knows and understands what's happening with their health. That type of solution allows us to ensure that we can safely reserve inpatient care and ICUs for those individuals in our community who will desperately need those services during the surge. We are also working with our hospitals and our partner organizations to ensure the capacity that we are building is going to be sufficient for us to meet the needs when that surge comes. To that end, we have a very strong partnership with Ascend Innovations, and they are developing a predictive model for us in the Dayton region to ensure that the plans that we are putting in place will actively meet the needs of our community and population. Right now, your job is to help us be ready. Our governor has emphasized it, Director Acton has emphasized it, and Health Commissioner Cooper has emphasized it. Help us be ready by staying home. This also includes when you visit the hospital. If you traditionally visit the hospital when someone is sick or if they have had surgery, we are asking you not to do that at this point in time. Our hospital facilities have restricted visitation, and so there will not be visitation allowed at the hospital facility while we are under the threat of COVID-19. There will be exemptions for end-of-life situations as well as maternity patients, and we ask you to contact your hospital, not the emergency department, contact the information line to ensure that you meet the criteria to have a visitor during your stay if necessary. We also ask that you be kind to the hospital staff and healthcare workers who are responsible for implementing these plans on the front lines of the hospital. Finally, in addition to staying home, in addition to following the instructions, we ask you to stay well, to take care of yourselves during this time that you have at home with your families and your loved ones, to wash your hands, cover your nose and mouth when you sneeze or cough, wipe your frequently touched surfaces, and take care of one another. We will get through this together, and we will see each other safely through this on the other side.
Thank you, Sarah. Next, we have Michael Doan, Public Health Medical Director.
Good afternoon. I'm Dr. Michael Doan. I'm the medical director for Public Health Dayton Montgomery County. I wanted to say a few words just because it's been a while since we talked about testing and things changed as far as criteria over the weekend. I just wanted to go through a few things. We've said before in this that this is an unusual circumstance. This is a novel and unusual virus. It's causing a new infection, but a lot of things are sort of the same. For instance, if you go to your doctor and they say you need one of these tests and they order it, just like any other test that your doctor orders, the result is going to come back to your doctor, okay? Whether you get it from, they do it in the office, whether they send you someplace else, if you go through the drive-through collection point, it's all going to be tied back to your physician, and they will be the ones getting the result. The results don't come to public health unless it's a positive result. And at that point, we would start an investigation to see what's going on and how to keep you and the people around you safe. It could be that the result, if you have one of the patient portals and you have my chart or something like that, you may be able to find the result there. But it's going to be your physician's office that is going to be the ones that will get that result. Similarly, we said it's the same in the sense that if you're sick, stay home, take care of yourself. If you have mild disease, under the new criteria, you're not going to get a test. If you have moderate illness, you're not qualifying for a test because we just don't have enough tests around. If you have a moderate illness and you also have other conditions that would predispose you to difficulties, that can be immunosuppression, diabetes, lung disease, other things, then you might qualify for a test. But for just people that have mild and moderate disease, that would be people that can take care of themselves at home without any other underlying conditions, there's no test indicated, and we just need people to stay home and take care of themselves. The other people that are in the priority are obviously people in the hospital with severe illness. They will get tested. As Commissioner Cooper mentioned before, we're concerned about not only healthcare workers, but also our public safety people. And we want to try and keep them on the job so that they also are a little bit higher in that priority if they get sick, to test them and find out what's going on as best as possible to keep them on the job for our own safety and our own health care. I'd say one other thing, that there are some rapid tests coming out. The rapid tests are saying you can get results in 20 minutes. That sounds great, okay? Except that those are tests looking for antibodies, so that after we get any infection, our body reacts to that, we begin to make antibodies, but you can't find those right away. So you may get a test result in 20 minutes, but that test isn't going to work for 4 weeks. So it's going to be 4 weeks after you got infected before that test is going to have a positive result. So I just want people to be careful that they don't on their own start to pay for a rapid test that probably is not going to tell them anything about whether what they're feeling at the moment is related to COVID-19. I think that's all. Is there anything else about testing?
We don't have enough.
Hmm?
We don't have enough.
We don't have enough tests. We'll say that again. So I just wanted to kind of go through that. The focal point for any test is your physician's office, the one that orders it, okay? Don't get taken in by rapid tests or some kind of new kind of spiel about how this is a test for this, because there's nothing out there except for the tests that go through the physician's offices that can tell you what is going on with you at the moment. And if you're sick and you can take care of yourself at home, You're probably not going to get a test. You just need to take care of yourself until you get better.
Thank you. All right, thank you. Thank you, Dr. Doan. So Dr. Doan raised a really good point earlier, and he indicated that public health does not receive all test results. However, we will receive test results for individuals who have tested positive. And then once we get those test results, that's when we do our routine work at public health in terms of reaching out to that individual, identifying all individuals that that person may have come in contact with, and we'll do our contact tracing. We've been made aware very recently that, based on information coming in on our information line, that individuals are being contacted by a text indicating that they may have been exposed to someone with COVID-19, and it's someone from public health trying to reach them. Do not fall for that scam. So we've had presenters here previously. Sheriff Rob Streck has been here saying, unfortunately, there are unscrupulous individuals out there trying to take advantage of others, even during this time of emergency. Don't fall for that scam. In the event that we get a positive test result on someone and we identified people that that individual came in contact with, we will contact you by telephone. We would never just send a text. We will do it by telephone to begin that process. So please don't fall victim to individuals who are trying to take advantage of you. And with that, be happy to answer, our speakers would be happy to answer any questions.